If you're a man over 60, does your heart sink when the phone rings after a doctor's appointment? You're dreading two phrases: your PSA is high, and the one that hits even harder: we need to schedule a biopsy. That one-word biopsy is terrifying. It's a journey of anxiety, discomfort, and weeks of waiting for a result that could change your life. But what if that journey could be completely different? What if, after that first confusing PSA test, there was a simple, 60-second step you could take from the comfort of your own bathroom, a revolutionary urine test that gives doctors a crystal-clear look at your actual risk? A test so effective at spotting only the dangerous, aggressive cancers that it could help tens of thousands of men, maybe even you, safely avoid the dreaded biopsy needle. This is not science fiction. This breakthrough is available right now. Before we dive in, do me a favor and hit that subscribe button. Our mission is to empower you with life-saving information, and you won't want to miss what's coming. To see why this new test is such a monumental leap, we have to get brutally honest about the old way of doing things. For decades, prostate screening has been a flawed one-two punch: the PSA blood test and the digital rectal exam. Both of these can send you down a rabbit hole of fear and unnecessary procedures. Let's break down why this system is failing so many of us. First, the infamous PSA test. PSA stands for prostate-specific antigen. For years, a high number was the ultimate red flag for cancer. But here's the stressful truth. The PSA test is a shot in the dark. It's notoriously unreliable. Why? Because a high PSA doesn't automatically mean cancer. It can be raised by a dozen other things: a simple urinary tract infection, inflammation from prostatitis, or the most common one, benign prostatic hyperplasia, BPH, which is just a normal enlargement of the prostate that happens to most men as they age. The PSA test can't tell the difference between harmless issues and a deadly cancer, leading to a massive number of false positives. Does this sound familiar to you or someone you know? You get that call, your world stops, and you're consumed with worry, only to find out it was a false alarm. Let me know in the comments if you've been on this emotional roller coaster. But the unreliable PSA test is just the gateway. It leads to the second, more feared step: the biopsy. When a man's PSA is high, the standard response is to recommend sticking a needle in his prostate 12 to 20 times to grab tissue samples. Let's be direct. A prostate biopsy is invasive and carries real risks, including pain, bleeding, and serious infection. And after all that, the results can create an even bigger problem: overdiagnosis. This is so important. The biopsy might find a tiny, slow-growing cancer, what doctors call indolent. These are cancers so non-aggressive they would likely never cause any harm in a man's lifetime. Yet the moment you hear the word cancer, it often leads to overtreatment. Men are rushed into surgery or radiation they never needed, suffering life-altering side effects like erectile dysfunction and incontinence, all to treat a cancer that posed no real threat. So what we have is a broken system. It starts with an unreliable alarm, leads to a painful procedure with its own dangers, which then leads to overtreating harmless conditions. It's a path paved with anxiety, and it has left men feeling powerless for far too long. Before I show you exactly how this new test is fixing our broken system, take a second. If you believe men deserve smarter, more accurate tools for their health, prove it by hitting that like button and subscribing to the channel. Your support helps us get this vital information out to the men who need it most. But finally, the tide is turning. Thanks to incredible leaps in genetic science, there is a new path forward. It's a test called My Prostate Score 2, or MPS 2. It's not a replacement for the PSA test, but a genius second step that brings much-needed intelligence to the process. Here's how it works and why it's a total game changer for men's health. First, and this is the key, it is incredibly good at finding the aggressive cancers that actually pose a threat. The old PSA test just measures one vague protein. The MPS 2 test is on another level entirely. It analyzes a urine sample for 18 different genetic markers. These are genes directly linked to high-grade, clinically significant prostate cancers. In other words, it's built to find the sharks, not the minnows. Here's a better way to think about it. The PSA test is a smoke detector that goes off whether you've burnt the toast or your house is on fire. It just causes panic. The MPS 2 test is the specialist who arrives after the alarm analyzes the air and can tell you with near certainty if it's a dangerous fire or just harmless smoke. It cuts through the noise of those slow-growing cancers that lead to so much unnecessary treatment. The result is a test with an extremely high negative predictive value. What that means for you is simple. If your MPS 2 test is negative, you can be highly confident that you do not have an aggressive form of cancer. This allows you and your doctor to breathe a sigh of relief and safely avoid an immediate biopsy. Second, it's completely non-invasive, and you do it at home. This is a massive deal. The latest version of the MPS 2 test is designed for at-home collection. Your doctor orders it, a kit shows up at your door, you provide a urine sample in your own bathroom, and mail it back. No awkward appointments, no invasive procedures. It replaces clinical anxiety with personal privacy. Third, it is proven to slash the number of unnecessary biopsies. This is the ultimate payoff. By giving a far clearer picture of who is truly at high risk, after an elevated PSA, MPS 2 can stop the biopsy train in its tracks for a huge number of men. How huge? Recent research is incredible. Studies have shown that using the MPS 2 test for men with a high PSA could have prevented between 34% and 53% of biopsies that were ultimately found to be unnecessary. Stop and think about that. For every 100 men currently told they need a biopsy, this test could spare up to half of them from ever having to go through with it, all without missing the dangerous cancers. So, what does this all mean for you, for your sons, for your friends? It means we are finally stepping into an era of precision in men's health. Imagine your next conversation with your doctor about a high PSA score. Instead of being a one-way ticket to the biopsy suite, it becomes a calm, informed discussion. It starts with, let's use this simple urine test to see what's really going on before we do anything invasive. For the man who gets a negative MPS 2 result, it's powerful peace of mind. For the man who gets a positive result, it means the system is working for him. He's being fast-tracked to the care he needs because the test has identified a potentially aggressive cancer that requires action. It focuses our best medical resources on the men who truly need them. Researchers are even exploring how this technology could help men already on active surveillance, those monitoring a low-grade cancer with repeat biopsies. The hope is that one day, a simple urine test could replace that process, though this is still being actively researched. What are your thoughts on this? Does knowing this technology exists give you a sense of hope or relief? Let me know your honest reaction in the comments section below. For decades, the journey of prostate health has been a path of uncertainty and anxiety. The blunt instruments of the past, like the PSA test, have caused immeasurable stress and led to countless unnecessary, painful procedures. But today, you have more control. You have better options. With revolutionary secondary screening tools like My Prostate Score 2, science has handed us a smarter way forward, a tool that separates the real threats from the false alarms after an initial PSA test. Knowledge is power. If you or any man you care about is over 60, please share this video. This is information every single family deserves to have. And most importantly, have a newly empowered conversation with your doctor. If your PSA is elevated, ask this simple question. Is a secondary biomarker test like MPS 2 the right next step for me? It's a question that could spare you unnecessary pain and give you the clarity and peace of mind you deserve. Thank you for watching. Don't forget to subscribe for more health breakthroughs that put you in the driver's seat. Your health is your wealth. Take charge of it.